Welcome back to The Fight. I'm Tricia Sloma. Joining us now from Vienna, Virginia is Dr. Richard Neville, the Associate Director of the Inova Heart and Vascular Institute and Vice Chair in the Department of Surgery. A graduate of Notre Dame's class of 1979, Dr. Neville is an international and international lecturer who has published over 100 manuscripts. Dr. Neville, welcome to The Fight.
Thank you, Tricia. Thanks for having me.
Good to see you. What has your work looked like during this pandemic, and are you still performing surgeries?
We are, Tricia, but I tell you, I've not come across anything like this in 30 years practicing medicine. It's really quite unique and quite different. Our healthcare system has really revamped and retooled itself to be ready for the crisis, and it's affected what we do in the operating room. But one thing we really couldn't allow to happen would be to forget the care of our patients who needed cardiovascular care as well. So we've tried to maintain the care of the patients that need this urgent cardiovascular care, as well as getting ready for the patients to address this crisis.
What have been some sources of comfort for you?
That's a good question. Well, of course, you have to start off with family. So my family still does let me come home. I've been going into the hospital every day, but my wife makes sure that I change my scrubs and wash my hands and jump in the shower as soon as I get home. Because we do have grandchildren. Actually, we've had two daughters that went to Notre Dame and a son. And of course, the two daughters that went to Notre Dame won't let me touch the grandchildren until I'm appropriately sterilized. But so obviously, family is a source of comfort. Tricia, colleagues have been a source of comfort, as we banded together to address the crisis. And the nursing staff, I got to tell you, my wife is a nurse, and there's nothing better in the world than nurses. They have just stepped up. They are taking care of these patients. They volunteer. They're on the front lines. The nursing staff has just been an inspiration. And the community's been an inspiration. The community has really rallied around the hospital and around the effort. We had one of the baseball players of the Nationals donate quite a bit of money to the effort, and the community's really stepped up. And then I got to tell you, Tricia, that Notre Dame has been a source of comfort.
And that's what I wanted to know: is the Notre Dame family pitched in, done anything special to help you during these unprecedented times?
They have. I really enjoyed the Faith ND website. So we do read that, my wife and I, and try to get the kids to read it. But it has been a source of comfort. That's really been a nice thing. We try to tune into Mass on Sundays to maintain that connection. So yeah, I think a spiritual base and a spiritual approach as you address crises like this have been important, because you can get bogged up in the anxiety, and people can get anxious, and they're working so hard, and it's such a source of tension and such stress that, a spiritual approach to the whole thing is very important. And then finally, I can't forget that my escape is to read about, the football team and the recruiting efforts and the football news. I also read the basketball, so don't let Coach Bray get too upset that I'm just reading about football. But football is my first love, so I read all the things I can get. That's my escape at night. I come home and read as much about the ND football program as I can.
Well, Dr. Neville, thank you for being with us. Thank you for what you're doing every single day, and thanks for sharing your insights with us.
Tricia, one more quick thing, in regards to the effort today, I just would like to say that, support and philanthropic support is
absolutely
critical right now. And I'll tell you why: because so many of our resources are being reallocated to the crisis and to areas where we haven't reallocated them before. So research and education are just so critically dependent now on philanthropy, and we can't let the research and the education go. That's the legacy to our trainees. So it's such an important thing now more than ever. And that's, one of the points I make to some of our donors. Now, if you ever were going to, now's the time. Now is when we need your help.
Dr. Neville, thank you so much. An impassioned plea. We appreciate you.
Thanks for having me.